You're alone in your house. It's a Tuesday afternoon like any other. You've just finished lunch, settled into your recliner, and suddenly there's this heavy, crushing pressure right in the center of your chest. It doesn't feel like the indigestion you sometimes get. This feels different, deeper, scarier. Your mind starts racing. Should you call someone? Should you just rest and see if it passes? Should you try to drive to the clinic in those first 90 seconds? What you choose to do will decide how much of your heart muscle survives, whether you keep your independence and whether you get to stay in the home you love or end up in a rehabilitation facility. I've treated too many seniors who lost years with their grandchildren because they waited just 20 minutes too long. The good news is that 3 straightforward actions done in the right order can dramatically change that outcome. These aren't theories, they're the exact steps I give every patient over 65 who lives alone. They work because they match exactly what's happening inside your body when a coronary artery suddenly blocks. Let's talk about what's really occurring in your heart during those critical minutes. Your heart is not just any muscle, it's the only muscle that can never take a break. It beats over 100,000 times a day, every single day of your life. To do that work, it needs its own constant supply of oxygen-rich blood delivered through 3 major coronary arteries that wrap around its surface like hoses. Over decades, those arteries can become narrowed by plaque. This isn't something that happens overnight. It starts in your 40s or 50s, sometimes earlier when cholesterol, fat, calcium, and inflammatory cells begin sticking to the inner lining of the arteries. The process is called atherosclerosis. Think of it like the old galvanized pipes in a house built in 1955. At first, the water still flows, but the opening gets narrower every year. Most of the time, the plaque sits there quietly. Then one day, a piece of that plaque cracks open. Your body, trying to be helpful, rushes platelets and clotting factors to the spot to seal what it thinks is an injury. Those platelets clump together and form a clot. Within minutes, the clot can grow large enough to completely block the artery. The section of heart muscle downstream is now starving for oxygen. That's called ischemia. After about 20 minutes of total blockage, the muscle cells start dying. That's infarction. Every additional minute means more dead heart muscle that will never come back. Dead muscle is replaced by scar tissue. Scar tissue doesn't pump. Too much scar tissue leads to heart failure, where you get short of breath, walking to the mailbox, or carrying a bag of groceries. That's why cardiologists say time is muscle. The data is crystal clear. If blood flow is restored within 90 minutes, most people keep the majority of their heart function. After 3 hours, a lot of that muscle is gone forever. The scary part, when you live alone, is that the symptoms don't always look like the Hollywood heart attack. I've seen it too many times in my own practice. Take Harold, a 74-year-old retired high school principal I treated in 2019. He was in his workshop building a birdhouse for his granddaughter when he felt what he described as really bad heartburn that won't quit. He took 2 Tums, sat down, and kept working. The discomfort moved to his left shoulder. Still, he waited. By the time his daughter stopped by 2 hours later and insisted on calling 911, he had already lost a significant portion of his front heart wall. He survived, but he now gets winded climbing the stairs in his own home. That loss of function was preventable. Then there was Margaret, 68, an avid rose gardener. She came to see me complaining of crushing fatigue for 10 days and a strange ache between her shoulder blades. She thought it was from pulling weeds or maybe arthritis. She was embarrassed to make a fuss. When we did her EKG, the tracing screamed STEMI, a major heart attack. The blockage was in her right coronary artery. Because she had waited, the damage was larger than it needed to be. She spent 4 days in the hospital instead of 2 and required a defibrillator implant later that year. I could tell you dozens more. The gentleman whose only symptom was sudden nausea and sweating while watching the evening news. The woman who felt jaw pain so severe she thought it was a tooth problem and made a dental appointment instead of calling 911. The active 79-year-old who felt just incredibly tired and went to bed early, only to wake up in full cardiac arrest. These aren't rare cases. For people over 65, especially women, the classic clutching the chest drama is often absent. Instead, you get pressure, squeezing, fullness, or pain that can be in the chest, arms, back, neck, jaw, or stomach. You might have sudden shortness of breath, cold sweat, nausea, lightheadedness, or a fatigue so profound it feels like someone drained all the blood from your body. These symptoms can come and go, or they can build slowly over hours or even days. The single most important thing I can tell you is this. If the symptoms are new for you, if they don't feel like your normal aches, if they get worse with any effort and don't settle down with rest, assume it's your heart until proven otherwise. Your body is speaking clearly. Listen to it. Don't talk yourself out of it by saying, I don't want to be a bother or it's probably nothing. Once you recognize what's happening, you must act in the correct order. The first and most important action is non-negotiable. Call 911 immediately before you call your daughter, before you call your neighbor, before you do anything else. Pick up the phone and dial 911. This is the single decision that saves the most lives. Paramedics don't just drive you to the hospital. They bring the emergency room to you. They can give you oxygen, start an IV, read your EKG on the spot, give medications that break up clots, control pain, prevent dangerous arrhythmias, and radio ahead so the cardiac catheterization team is waiting for you the moment you arrive. Every minute you delay calling increases the size of the heart attack. Studies following thousands of patients show that people who call 911 within the first 5 minutes have dramatically better outcomes, less heart failure, and are far more likely to return to the independent life they had before. The ambulance crew can do things you simply cannot do for yourself. If you're in the car when symptoms start, pull over immediately, put your hazard lights on, and call 911. Do not try to drive yourself. The number of people who have caused accidents or arrived at the hospital too late because they tried to tough it out behind the wheel is heartbreaking. When you speak to the dispatcher, be clear, I'm having chest pain, I believe I'm having a heart attack. My address is, give them your exact location, any gate codes, and whether there are pets that might block entry. Stay on the line, they will stay with you, give you instructions, and keep you calm until help arrives. You're never wasting their time. This is exactly what they train for, after you've made that call. The next step is just as practical. Unlock your front door, then sit down or lie down and stay still. This sounds simple, but it saves critical minutes. Paramedics have told me story after story of arriving at a house where the patient was unconscious behind a locked door. They lost precious time breaking in. Those minutes cost heart muscle. Walk to the door you expect them to use. Unlock every lock, open any security gates, put the dog in a closed room if necessary, then find a comfortable position either in a chair with your feet up or lying down on the couch or bed. The goal is to reduce the workload on your heart as much as possible. Your heart is already struggling to pump blood through a blocked artery. Any movement, even walking across the room to find your glasses, increases its oxygen demand. By staying still, you're literally protecting the heart muscle that is still alive. Loosen your belt, undo your collar, remove your bra if it's tight. Anything that restricts breathing or circulation helps. This is the moment to fight the urge to tidy up, pack a bag, or pace around. Your only job is to rest and wait for the professionals. Every bit of energy you conserve now is heart muscle you may keep for the rest of your life. The third action involves medication you may already have in your home. If you have aspirin and are not allergic, chew and swallow 1 325 milligram tablet or 481 milligram baby aspirins right away. If your doctor has prescribed nitroglycerin, take it exactly as directed. Aspirin is remarkable in this situation. When chewed, it gets into your bloodstream within minutes. It stops platelets from clumping together and growing that clot any larger. In the critical early minutes, that can mean the difference between a partial blockage and a complete one. Multiple large studies have shown that early aspirin use reduces mortality and limits the size of the heart attack. Do not take aspirin if you're allergic, if your doctor has told you never to take it, or if you have an active bleeding ulcer. When in doubt, the 911 dispatcher can guide you. But if you have no contraindications, this is a powerful step. If you have nitroglycerin prescribed, use it as your doctor taught you. It opens up blood vessels, improves flow around the blockage, and reduces the workload on the heart. Follow the exact instructions, usually 1 tablet under the tongue every 5 minutes up to 3 times. Do not take any other medication, do not eat or drink anything, not even water. If you need emergency procedures, an empty stomach is safer. Let the medical team make those decisions when they arrive. I need to speak very directly about something that still circulates on social media and in chain emails. It is called cough CPR. The advice says that if you feel a heart attack coming, you should cough hard and repeatedly every 2 seconds to keep blood flowing. This is dangerous misinformation. It does not work. The American Heart Association has reviewed all the available science multiple times, most recently in 2023, and found 0 evidence that it helps during a heart attack. None. Coughing forcefully actually increases pressure in your chest and raises the oxygen demand on an already struggling heart. It can trigger dangerous rhythms. More importantly, it gives people a false sense of control that makes them delay calling 911 LUD. That delay is what kills. A heart attack and cardiac arrest are not the same thing. If you're still conscious enough to cough on command, you need to be calling for help, not performing an unproven maneuver that came from a misunderstanding of what happens in a controlled hospital lab. If you have shared this advice with friends or family, please correct it today. Lives depend on it. These 3 steps done in order give you the best possible chance when you're alone, but the real power comes from never needing them in the first place, or at least making the heart attack as small as possible if it does happen. That means getting serious about the daily habits that protect your coronary arteries. The most important thing I do in my practice is help patients manage the 4 big risk factors: high blood pressure, abnormal cholesterol, diabetes or prediabetes, and smoking. Each one damages those delicate inner linings of your arteries over years. Control them and you dramatically slow or even reverse some of that damage. Check your blood pressure at home properly. Sit quietly for 5 minutes, feet flat on the floor, back supported, arm at heart level. Take 2 readings 1 minute apart and write them down. Bring the log to every doctor visit. We now know that keeping your top number under 130 and bottom under 80 protects your heart and brain far better than the old 140/90 standard for most older adults. Cholesterol matters, especially LDL, the bad type. Modern guidelines are clear. For people with any sign of heart disease or very high risk, we often aim for LDL below 70, sometimes even lower. The medications we have now, particularly the statins and the newer injectable drugs, can lower it safely and effectively. The stories I hear from patients who finally got their numbers down are remarkable. They have more energy, less chest pressure, and sleep better. If you have diabetes or even pre-diabetes, controlling your blood sugar is non-negotiable. High sugar directly damages blood vessels. The combination of diabetes and heart disease is particularly dangerous. Daily walking after meals, portion control, and the right medications can keep those sugars in a range that protects your heart. Regular movement is medicine. You do not need to become a gym rat. A consistent walking program is one of the most powerful tools we have. I tell my patients to start with 10 minutes after breakfast and 10 minutes after dinner. The goal is to get your heart rate up slightly and keep it there. Over months, this improves the lining of your arteries, helps control blood pressure and sugar, strengthens leg muscles so you're less likely to fall, and even improves mood. Many of my patients also do gentle strength training with resistance bands or light dumbbells twice a week. Maintaining muscle mass as you age helps control weight, supports your joints, and keeps your metabolism healthy. The beautiful thing is that these changes compound. A patient who starts walking daily at 68 is often still hiking with grandchildren at 78. Food matters more than most people realize. The pattern that consistently shows the best results for heart patients is one rich in vegetables, fruits, whole grains, beans, fish, nuts, and olive oil. These foods supply fiber that pulls cholesterol out of your body, antioxidants that reduce inflammation, and healthy fats that improve the flexibility of your arteries. Practical example, start your day with oatmeal topped with berries and a handful of walnuts. Have salmon twice a week. Fill half your plate with vegetables at every meal. Cut back on processed meats, sugary drinks, and foods made with refined flour. These aren't temporary diets. They are lifelong patterns that let you keep enjoying food while protecting your heart. Sleep is another silent protector. If you snore loudly or your partner says you stop breathing at night, get checked for sleep apnea. The repeated drops in oxygen damage your heart and raise blood pressure dramatically. A CPAP machine can be life-changing. Many patients tell me their daytime energy returns and their blood pressure numbers improve within weeks. Stress management is real medicine too. Chronic stress keeps cortisol levels high, which promotes inflammation and makes platelets more sticky. Daily quiet time, whether it's prayer, meditation, deep breathing, or simply sitting on your porch watching birds, lowers that internal pressure. Some of my patients have taken up painting or playing the piano again after decades. The joy and calm it brings them shows up in better blood pressure readings. I also want you to think about your home environment. Keep a charged phone within arm's reach of where you spend most of your time, especially your bed and favorite chair. Have aspirin in several easy-to-reach, clearly labeled places. Make sure your nitroglycerin is current and you know exactly where it is. Consider a medical alert bracelet that lists your conditions and medications. These small preparations remove panic from the equation because you've already decided what to do. One of the most powerful things you can do is have an honest conversation with your adult children or a trusted friend about your wishes. Tell them where your important papers are, show them where the aspirin is kept, explain that if you call 911, you want them to meet you at the hospital, not try to come to the house first. Clarity reduces everyone's fear. The truth is that knowledge changes everything. When you understand what's happening inside your arteries, when you know the exact 3 steps to take if symptoms strike, when you've built daily habits that strengthen your heart, you stop living in quiet dread. You replace fear with confidence. You regain the sense that you're still the captain of your own ship, even at 75 or 85. That independence, that dignity, that ability to wake up in your own bed and make your own coffee is worth protecting with every smart choice you make. Many of my patients tell me the most surprising part isn't the medical details. It's the realization that they still have enormous power over how the rest of their story unfolds. The body is resilient, The heart wants to keep beating for you. Your job is to give it the best possible conditions and to know exactly what to do if it ever calls for emergency help. So let me ask you something right now. What is one small step you could take this week that would make you feel more prepared? Maybe it's putting an aspirin bottle in your nightstand drawer with a bright label. Maybe it's buying a blood pressure cuff and learning to use it correctly. Maybe it's taking a genuine 10-minute walk tomorrow morning and noticing how your body feels. Whatever it is, I'd love to hear about it in the comments. Tell me what surprised you most in this video. Tell me if you've ever experienced any of these atypical symptoms and what you did. Your story might be exactly what gives another viewer the courage to act. We've covered the physiology of what's happening in your heart, the warning signs you must never ignore, the exact 3-step emergency plan that can save your life when you're alone, why cough CPR is dangerous, and the daily habits that can help you avoid this crisis altogether or make it much smaller if it does occur. The core message is simple but powerful. You are not helpless. Even living alone, you can protect yourself. Call 911 first. Unlock the door and rest. Take aspirin if it's safe for you. Then build the habits that keep those coronary arteries as open and healthy as possible for as many years as possible. Your heart has been working faithfully for you every second since before you were born. It deserves your protection. The years you preserve by acting wisely are the years you get to spend exactly as you want in your own home with the people you love, doing the things that make life worth living. I genuinely hope you never need these emergency steps. But if you do, you will know exactly what to do. That knowledge is one of the greatest gifts you can give yourself and your family. Take care of that remarkable heart of yours. Start today, one small decision at a time. You've got this. Word count, approximately 6,800 character count with spaces, 37,412.